Hi, good morning, Antonia. My name is Michael Lees. I'm your invigilator for the OET speaking session conducting on the 18th of February 2021. How are you doing?
Hi, good morning. I'm good. Thank you for asking. How about you?
Well, I'm great. Now, can you say your full name for the record, please?
My full name is Antonia Martin.
And what is your candidate number, please?
My candidate number is 231073198.
Thank you. And you are taking this test as a nurse. Is that correct?
Yes, correct.
Thank you. Can I see your ID, please?
Sure. Here it is.
The warm-up questions are not assessed, and are a chance for us to get used to each other's voices. We'll just talk for 2 to 3 minutes.
All right.
Explain how you would deal with someone who is not satisfied with your level of care.
I once had a patient who had Googled their symptoms and thought that the care I was giving them was inadequate. They were adamant that my team should be treating their infection with a different drug, and even convinced their family that they weren't being looked after. In the end, I Googled the symptoms too, and found a different article in which our treatment was recommended, and shared this with the patient. I then spent some time explaining to the patient and the family why we'd chosen this specific drug over the other. They were still skeptical, but we managed to persuade them that we were giving them the best level of care.
What are you passionate about?
I'm passionate about giving the absolute best possible care to all of my patients. I take pride in my work, and I am passionate about making a difference to people's lives.
How do you propose to manage a crisis?
If there is a crisis at work, first I will try to understand the situation, and identify whether it's something that I can handle, or it largely concerns the senior management. If it is under my jurisdiction, I will evaluate the resources available to me, and design an action plan to effectively deal with the situation. I will take the help of my colleagues and try to take care of the situation. However, if the matter concerns the senior management, I will escalate the issue to the appropriate person.
How would you rate your organizational skills?
Overall, I'm a very organized person, particularly at work. I consider staying organized both at the desk and away from it to be a critical part of doing an excellent job in any line of work. Planners, sticky notes, and folders are all a part of my normal workday organization. And they all play a part in helping me to ensure that I don't let a single patient detail slip through the cracks while I'm taking care of my many workday duties.
Are you a team player? Tell me about a time that you worked well with a team.
I would say that I'm a good team player. As I said, I like to make sure that my team knows that I'm there for them, and I make sure to support all of my colleagues' decisions. One great example of this is when we lost a patient in my last job. It was really sad and unexpected. But I supported the physician I was working with, and ensured her that she'd made the right call, in terms of the medication. And I made sure that my colleagues could share their feelings with me. We also talked about it later on, to work out if there was anything we could have done differently. Hence, we turned a difficult situation into an opportunity to grow.
Great. Thank you very much for sharing that. So, let's move on to the role plays now. I'll take the part of the patients, or perhaps a relative, and you'll take your professional role. The purpose of the role play is to get evidence of your ability to communicate effectively with patients. Use your ability to fulfill as much of the role play as possible. Do you have any questions?
No.
You have up to 3 minutes to prepare the role play. You will start the role play after that time. I'll let you know when 3 minutes are up. You can ask me if there's anything you are not sure about, and you can make notes on the role play card if you want to. Here's a pencil for making notes.
Thank you.
You can look at the card during the test, but you must return it to me at the end of the test. Please start preparing now. Thank you. Your preparation time is over. You can now start your roleplay. Don't worry if I stop you when the time is up.
Hi, good morning. My name is Antonia Martin. I'm the occupational health and safety nurse of the company. May I know your full name for the record, please?
My full name is Michael Lees.
Hi, Michael. Nice to meet you. May I know your age, please?
I'm 45 years old now.
Okay. Tell me, Michael, what makes you here today?
I was informed by the management about the availability of occupational health and safety nurse of the company. So, I thought of doing a health check.
That's great. I appreciate your time and effort to make use of the opportunity. This service is totally free and confidential.
Thank you for the compliments.
Michael, may I know, do you have any health concerns?
Well, nurse, my father died of a stroke at the age of 55. So I would like to get my blood pressure checked.
Sure, please hold your hand in this position while I check for your blood pressure.
Okay.
Thank you. Now, please stand next to the wall, so that I can measure your height. And then, onto the weighing scale, for checking your weight.
Sure.
Michael, your reading says, weight is 82 kilograms, height 178, and your blood pressure check shows 150/90.
All right. Is there anything abnormal?
Yes, but before getting into that, may I have a few questions about your lifestyle, please?
Sure, you may proceed.
Thank you. First, shall I know about your diet pattern?
Mostly, I consume takeaway food like burgers, chips and all. It's mainly because of my travel schedule.
All right, I can understand your situation. Anyways, could you please tell me about your exercise pattern?
I'm really sorry to say that, I don't exercise much.
Oh. Okay. By the way, do you have a habit of drinking and smoking?
I won't smoke at all. But, drinking. I consume beer on the weekends.
All right, thank you for sharing this.
You are welcome.
Finally, I would like to know when you last visited your GP?
Nurse, I haven't visited my GP for almost 15 years.
Michael, from my point of view, it is quite a long period of time, without a medical consultation. I understand that you were healthy during these years. However, I recommend you to have a periodic health checkup.
I acknowledge your recommendation, nurse. And I assure you that I will follow your instruction.
Glad to hear, Michael. Well, from my assessment, your BP indicates borderline hypertension, and it requires to be checked regularly.
Is it?
Don't panic, Michael. When age increases, blood vessels lose their elasticity. So the systolic blood pressure increases. Therefore, it is important to check your blood pressure regularly. Some experts call it the silent killer. High blood pressure, or hypertension, most often has no symptoms, so a significant number of people who have it might not realize it. It is worth noticing that untreated high blood pressure can damage organs over time and lead to stroke or heart disease.
Okay, I am ready to follow your suggestions with no delay. But what should I do to avoid stroke?
I realize your concern, Michael. With proper diet and lifestyle changes, your blood pressure can be controlled. I recommend following a few measures, such as reducing weight by healthy eating habits. For example, consume less fat and less salt diet. Include more vegetables and fruits in your diet.
Sure, I will.
Also, you should reduce beer consumption to avoid excess fat accumulation. Last, but not the least, it's mandatory to do 30 minutes of exercise, 4 to 5 times in a week.
Sure, nurse. I'll follow your recommendations.
I am really happy to hear that. Do not forget to have a regular health checkup. I wish you a healthy life ahead.
Thank you, nurse.
You are very welcome.
That is the end of your speaking role play. All the very best.
Thank you. Thank you for watching. Please, like this video and encourage us.
Subscribe and stay tuned for more videos. Kindly comment your suggestions and help us do better.